Guys, welcome back to Medical Coding with Blue. It's Quiz Friday. I'm going to change up Quiz Friday just a little bit. So I did get a request from one of the viewers about when are we going to start doing procedural coding. So I threw in a couple of procedures on this Quiz Friday. Keep in mind that these are based in the outpatient setting. So keep in mind about the rules about coding symptoms. And the procedures can be found, of course, in the CPT book. The 2017, 2018, or 2019 versions all have the same procedure code for the two that I did do. So if you have any of those books, that's fine. Okay, so we will be discussing the answers on Answer Monday. I will be including the questions down in the description box below. But keep in mind that if they're not there right away, it's only because I like to upload the video first and then I go back in, I add all the questions. So that's the only reason why. So if you happen to catch the video as soon as I posted, the questions are not going to be there right away. So just be patient and I will get them uploaded. Okay? You can send me your answers if you like, or you can wait till Answer Monday. If you have any questions during the weekend, please feel free to email me, and I will include my email address down in the description box below. Okay, so let's get started. Number 1 is hourglass stomach. I had to put that one in there because as I was going through the book, I was like, oh, that's a fascinating diagnosis. Number 2 is PTSD and nightmares. Okay. Number 3, diabetes type 2 with CKD or chronic kidney disease, stage 5, with hypertension, with end-stage chronic systolic heart failure on insulin. Number 4 is cubital tunnel right and cubital tunnel left. Number 5 is hallux rigidus left foot, hallux rigidus right foot. Okay. Number 6 is a bimalleolar fracture of the right lower leg, initial visit, after a fall from stepping on a Lego. Okay. They did a closed reduction treatment with manipulation for this fracture. Okay. Number 7 is chronic, recurrent, moderate depression, current episode. Okay. Number 8 is paranoid schizophrenia. Number 9, the patient had convulsions and was diagnosed with generalized epilepsy with Todd's paralysis. Okay. And number 10, right distal supracondylar femoral fracture. After the patient was in an MVA, the patient was the driver in a head-on collision with another car. Okay. They received closed treatment with manipulation for their fracture. Okay, so that's it. That was number 10. So let me know if you have any questions. Feel free to email me. So I've been getting quite a few emails about people that are interested in getting into the medical coding field. So I wanted to give a little quick message about that. If you are truly interested in getting into the medical coding field, I will tell you this. It is a lot, and I mean a lot of studying. If you are somebody that likes to read, if you're somebody that likes to study all the time, this is a great field for you. Some people will get into this because they are told that it's a lot of money. It is a very good paying field, okay? But it is a good paying field for a reason. You have to work for it, okay? Because in the beginning, medical coders there's quite a few, if not many, coders that have a very hard time getting into the field in the first place, even after you're certified. And this is because a lot of employers are wanting you to have experience for at least a year or 2 years before you can even get started. So what happens is a lot of people get frustrated and just quit, and understandably so, because, why would you want to get into a field where you worked so hard and you studied and you got your certification and you passed and everything, and then you can't get a job because you have no experience? It takes a lot of determination and a lot of hard work to get your foot in the door. I've done quite a few videos on my struggle getting into the field, okay? So I'm just letting you guys know now that if you are truly, genuinely interested in it, it does pay very handsomely, but please don't let that be the reason that you want to get into it. And it's hard to hear, like, some people use that as a selling point to get people to get interested in medical coding. I would never do that. I would never, ever, ever, ever encourage anybody to get into the field just because of the money. Okay? Because a lot of times people end up getting frustrated. Well, I couldn't get a job and I couldn't do this. And I understand because I went through it. I was there. Okay, I went through that. I went through them telling me no, or me going and applying and passing their test, because every place that you apply, you're going to have to take a test, because they're going to want to know what is your background, how much knowledge do you have, how detailed are you. And I went through them telling me, oh yeah, you passed our test, but you don't have any experience. So it was a rough time for me. And I did one video where I got very emotional because I can still remember what it felt like to work so hard to get in. But now that I've been in it for over a decade, and I love what I do, So I would encourage this field for anybody that wants to find a career that is intellectually stimulating, because that's exactly what this is. The money will come in time, but, don't let that be the reason that you get into the field. And I will always stress that. Okay? So, if you are genuinely interested in the field, I hope you'll check out my other videos, because I do try to make my videos say the topic of what the video is about. So that way you guys can do your research and make sure that make sure you do all your research before you decide on doing anything like this. Okay? And I will encourage anybody that is truly interested. I hope that there's a lot of people that are interested in this field, because it is to me is rewarding. I enjoy it. So if you have any questions, please feel free to email me. I always leave my email address in the description box anyway. And I will be leaving the 2 addresses for the 2 associations that offer medical coding credentials. The American Health Information Management Association, which is the association that I belong to very proudly. And the American Academy of Professional Coders, AAPC. Okay? So please do your research, and if you have any questions, let me know. And if you are a medical coder, a medical coding student, somebody curious about the fascinating world of medical coding, a provider or a nurse, I invite you to like and subscribe to my channel and follow me on my journey in medical coding. I hope you all have a great weekend, and I will see y'all for Answer Monday when we're discussing the answers. Bye!